This is the Throat, Nose and Ear Hospital on Gray's Inn Road in London. When you come for an appointment, bring your appointment letter with you. You can bring someone with you for support. The main reception staff will direct you to the outpatients reception. You can book in with the reception staff or check in yourself at a kiosk.
Hello, this is Jill. Jill's got an outpatient appointment today.
Okay. So are all your details the same? Your address, telephone number, GP. Do you have a disability at all?
Yes, I have a learning difficulty.
When you have booked in, you'll be asked to go to the waiting room. The nurse will then call your name.
Jill Hunt.
And you'll go to the consultation room.
Hello, Jill. My name is Rose. I'm one of the nurses here. Is this something you want to have a look
Yes,
at?
this tells you all about me because I have learning difficulties.
Your hospital passport can give nurses and doctors valuable information about how best to support you and to communicate with you. The nurse will need to do some tests. This patient needs to have their ears cleaned before they can have a hearing test.
So I'm just going to take the wax out. It might feel a little bit ticklish.
Other patients might need to have other tests. These may include a peak flow test or a nasal flow test. Some patients may need to have a skin allergy test like this, or do a smell test.
So this is the smell test. Just tell me what you smell. Rose, apple, plum, banana.
The nurse may want to check your weight and other measurements too. None of these tests should hurt, but tell your nurse if you're concerned or have any questions. Easy read information is available if you need it. Now that this patient has had their ears cleaned, they can go for their hearing test.
This is really simple. All we need to do is to pop the headphones in your ears. I'm going to give you a push button, and all you're going to have to do is to listen very, very carefully. And every single time you hear anything at all, you're going to quickly press the button for me. Well done.
After the tests have been completed, you'll go to see your doctor.
Hello, hi Jill. Nice to meet you. My name's Calvin, one of the surgeons here.
You can show the doctor your hospital passport. The doctor will need to ask you some questions and speak to you about what further procedures you may need.
I've looked at your hearing test results and your ear pressure test results. The right eardrum has shown evidence of quite a negative pressure. So that is probably the reason why you have a reduced hearing. What we could actually offer you is something called a Grommet Insertions.
I don't understand what grommet means.
A grommet is basically a hollow tube that we put in the eardrum itself, and then we expect the hearing will actually get back to normal.
Doctor, do you have any easy read information that can explain what you're going to do too, Jill?
Yeah, sure. I will ask one of my nurses to bring it to you.
Before you leave the hospital, you will need to book your next appointment with the receptionist.